rural communities and like us.
Yeah. So we talked about that, like, we don't have plans, we're not that far along in the process, but maybe this is a step we could take is apply through this program, secure, a location, and then we have something when we go after dollars to say, okay, well, we've done this and this is where we're at right now, so that's.
Well, just as a reminder, the CCO is required this year to do something about housing. What that is, our board needs to decide. But the other piece that Kenny LaPointe, he spoke at the Regional Community Advisory Council a lot. Even if you don't really prioritize it, you probably want a line about housing in your plan, because then local projects who have something mentioned in their community health plan at the local level, you get additional point scoring in your application.
Cool.
So.
At our collaborative meeting this morning, the housing issue came up, and for seniors, that's a huge issue. They were saying a lot of seniors with their monthly, they were saying $1,000 a month is maybe how much they have for living, and for rent in this town is $700 a month.
Yeah.
That's a good deal.
That's
You
actually
can get it
a
for
good deal.
And so low-income housing for seniors is a huge thing. We also talked about a real need for our behavioral health foster care. There is nothing here in Lake County for that. And there is really a need here, so.
One of the reasons Charlie Pike, our veterans officer, we had originally invited Gus Bidwell and McDonald down, was because this housing thing is really affecting him and the work he does with the veterans. The veterans represent a huge number of the homeless, or at least the people that struggle with these issues in our county. And he is constantly fighting it. And he just came in my office one day and he's like, we need help. I mean, I am sending all these guys away. We actually have a gentleman from Lake County a veteran who went away and fought in the Gulf War and came back after serving multiple tours, and the county had foreclosed on his property because he hadn't paid his taxes while he was away fighting for our country. And he lost it. Everything. That's actually a true story. Our assessor was telling us about it. And it's like, I felt horrible when we realized what the situation is. But you have a process and everything else. Someone's paying their taxes on a piece of property, and then the vet comes back from multiple tours, and now he's essentially homeless. And he has no property anymore. It's gone. His house is gone. Everything. And so like that's one case, but the veterans do represent a big number in our community. And so from our county side, the veterans, we will do whatever we can to help facilitate in fixing this problem.
We're also showing that a lot of seniors who, through Medicaid, were eligible for whether nursing home or assisted living, but due to new changes and requirements, I know up in Umatilla County we've had at least 6 people evicted, and essentially you can say back on the street as a senior. And in order to be eligible for Medicaid, in the first place, you basically can't have any resources. So even if you had a home, then you had to sell it, and then all of a sudden you're not eligible anymore, and you're back out again, you don't even have a home.
Bad. Yeah.
So.
Bad.
Yeah. Very true.
Have any more quick updates?
Yeah, next small update I have is, so there's a CEP program in the state of Oregon, and it's for the schools, and if any school qualifies for the CEP program, all their lunches free. The school doesn't have to pay for them. The North Lake School already qualifies for that program, and I have a meeting, so next week during the learning fair, I'm meeting up with Principal David Kerr, and we'll go over that. I just need, I think I need some more data, and we need to send it to the organization, and so they are qualified. I'm also working with Susan Warner, and we just need some data from ADK Fremont. That's the only school that will qualify for the CEP program, not the Daily Middle School. Were you telling me something?
Yeah, well, the numbers aren't there right now, but Susan was saying that she sees the numbers get higher and higher every year, so it's just a matter of years before they're at that 40%. I think it's like 38 something right now.
Yeah.
So.
Are you talking about the free and reduced number?
Yeah.
What about 56%?
So that's what the numbers that we report to the state are, but the number that they use like a certain calculation that they use instead of what we use. So it's the number that we serve is different than the number of students that are eligible for this program. So that's why our percentages have been so off. But one of the thoughts is that there's not every family that's eligible for SNAP is participating in SNAP. So if we had those numbers higher SNAP participation, and families saying that they're participating in SNAP when they're requesting free and reduced lunch, then that number you'd assume it would be higher. I don't really know where to go with that. We've been having the same conversation.
DHS manages the SNAP program?
They do, yeah.
Anything I can do to support you on that, Brooke?
Man, I don't know. I don't really know where to go. This isn't really something that's part of food course. I've been dabbling in it because I care a lot about it, but I don't really know where to take it and don't have the time to put into it, really, unfortunately.
Has anyone heard anything? There's a big push right now in the legislature to get universal school lunches in Oregon. Does anyone know where that is at?
I think it's still in committee. I don't think it's headed to the floor yet, so.
No, they
that's
had
all
their
I know about it for right now.
They had their first meeting about it like 2 weeks ago. I haven't heard anything. So. That's a big push, though. I think this is something that's going to have to get talked about a lot before it would pass, but there's a need.
Yeah, and for the CEP program, online there's a template where if there's a discrepancy with the numbers that the school is showing and what the state says, so they just ask us to submit that data again before April 1st. And so that's the plan.
Before April 1st?
Yeah.
So we have a very short time window.
Yeah, we have been discussing this for a while now, and navigating what data we need to send. So we have some data. I have to meet up with Susan Warner, and so once the data is sent, fingers crossed, hopefully we qualify for the CEP program.
And that's for Fremont and ADA?
No, that, yeah.
Or is it for the whole district?
Only
No,
Fremont.
only 88.
Yeah. And it's breakfast and lunch. So
Breakfast and lunch?
yeah,
Only
That's a
who?
huge thing.
yeah.
88 Fremont, it's
The
the.
elementary school.
Oh, okay. Is this widely known, Arvinder? I haven't heard any of our other CACs talking about this.
Brooke informed, yeah.
Yeah,
but we-
Christy randomly forwards me things sometimes, and I happen, we just found the right information, luckily. And because the article was about the rural schools, the problem is they don't know about it. It's not talked about enough, and so many schools are eligible.
Yeah,
Is there
Yeah.
anything we can do to help? Because this would be a huge thing for our community.
I think a lot of it comes down to the stigma of using SNAP, and that we don't have enough participation overall in our SNAP program.
But that might be something we can talk with DHS about, where we get, because if we can bypass that stigma.
Does it have to be as reported by the families, or could you get numbers from DHS of what number of people with child dependents that those age range? Is that possible, or does it have to be ones that are self-reported to the school?
I don't know the answer to that.
We're going to run
Because-
into a confidentiality issue.
Right, right.
They
So I
can't
know,
use that kind of information specifically for families. So I'm not entirely sure how that would help. They can give you a number.
yeah. Yeah. It's tough.
Yeah, even the folks at North Lake weren't aware about this program.
And they were well over that 40%.
Have you found any other schools in Eastern Oregon that might be using that program? Because I feel like
I
Vail
heard somewhere.
does it.
They use it.
Did I?
I don't know. I know most of the other food corps schools so people that do the same position as me, their schools are usually using CEP, but it's because they're eligible and the numbers say they're eligible, where for us, for some reason, the numbers, they don't match up.
But we do have a list of all Oregon different county schools who have qualified and who are making use of the program. So we do have a list, and yeah, so I can tell you which schools or what counties are making use of that.
Maybe we could reach out and see if they had the same obstacles that we're having,
Yeah.
to see if maybe how they close the gap.
Yeah.
Do you have somebody at CEP that you can talk with?
So it's through the ODE, and that's who can.
Yeah, so I had one contact who I had spoken to, and they just gave me a link, and they were like, it's pretty straightforward, and whatever data you have, just submit it, and they'll go over that data. If they have questions, they'll reach out again to us.
And this is a state program, or is it a?
I think it's a state program.
What does CEP stand for?
Community Eligibility Program,
Okay.
or provision, one of those.
I would bet that the state is a pass-through. That's usually what happens with the Oregon Department of Ed, that it's a federal program.
Yeah.
I would guess that this is one of those.
And the idea is once like these schools who are part of the CEP, they're able, when you have higher numbers of students buying school lunches, you end up getting more money back into your school lunch program. So then you can offer better options on the lunch menu, and just kind of everything comes after that, right? It's a great cycle.
So will this start next school year? Is that the?
I believe so, and it's a 4-year program. So once you're in, whether your numbers dip or not, you're locked in for 4 years.
Okay.
Yeah, cool. So not that many of them are dipping, they're usually getting higher. Yeah.
When do we lose you, Brooke?
My term ends in July.
Okay.
So, yeah, so the next trip update is, do you have any updates about food corps?
Yeah, I actually am really excited because we're going to be doing some family cooking nights. I'm hoping to get this little flyer out early next week. I'm planning on doing 3 family cooking nights, and I just connected with Daphne Greer, who is through ESD Take Root Parenting is the group, and they're really interested in sponsoring this. So the goal of this one, I've also connected with a parent volunteer who's willing to help out quite a bit. So, but these 3 are really just about trying to encourage families to cook with their kids and just cooking together. But we did discuss, and I think I've mentioned this before, is the Cooking Matters curriculum, which is like a nationwide curriculum. It's really well-known and well-respected, research-based, and it's a 6-week program that focuses on nutrition and also affordable, like the food actually being affordable. It's partly cooking classes, partly tours of the local grocery store. So they are interested in partnering with that, and maybe us doing that over the summer too. So if you guys know any people who might be interested, we're hoping to get more partners together to talk about this and get this up and running, because I think that'd be really great for our community.
So there were 2 programs associated about Cooking Matters and Shopping Matters. Are they've been blended now?
So I haven't heard of Shopping Matters.
Same people,
okay.
it's, you know, and they actually do the food tour, or the tours
Yeah.
of stores. And they were supposed to be coming up with one that, like people in Paisley would really benefit from, where there's a limited choice from the supermarket perspective, like going into a way to shop and eat stuff at a small 7-Eleven or something like that. So that, they were talking about that as an extension, which would work for, you know,
Yeah.
local markets where there's less choice than Safeway.
So half of this is just the, like the actual curriculum, and a lot of it, like, I mean, there's label reading, talking about how to shop too. So
Right.
they
Maybe they
might
blended them.
combine
Okay,
Yeah. So,
that's Walmart.
yeah, they're funded through Walmart. Thanks.
Okay, Chrissy, I think, has some exciting grant updates for us.
They're always exciting.
They are always exciting, but today is especially exciting.
So, some of y'all know and are already looking forward to an exciting week of meetings next week, but we received all 4 grants that we asked for from the OCCO. So for those who don't know what we asked for, the LCAT grant is the big one. That is the non-competitive grant that we just have to let the OCCO know how we're going to spend these dollars. So we're using some of it to address some of these incentive measures. So developmental screenings, like you guys saw, that was one of the ones that killed us. We have a diaper incentive program at both Lake Health and Warner Mountain Medical Clinics, as well as at Public Health now. And at the Christmas Valley Clinic as well. Christmas Valley also has a gas card incentive, so when parents come in, get their kids, go through do the developmental screening, get it signed off by the proper authorities so that we can then bill and get reimbursed through the OCCO. Parents receive a pack of diapers in the appropriate size, and in Christmas Valley, they also get a $10 gas card because it's, you can't just walk a few blocks to get to the doctor there. So we're also looking at our prenatal and postpartum care and making sure that we're getting moms in for their first prenatal appointment during their first trimester, and then having their postpartum appointment 3 to 8 weeks after delivery. So the women who meet those timelines, they get a gift card from Amazon if they do that. Third incentive, the childhood obesity, the weight assessment and counseling for physical activity and nutrition is Susan's favorite measure. That was last year, it was the new incentive measure. And so kids ages 3 to 17, you go in and you get your weight and height, so you get your BMI, and that's the weight assessment, and then is it everyone? Is that what we decided, regardless of what? Okay, so all those kids have to.
BMI is the easy part, so
yeah,
there are 2 parts.
They have to be counseled for physical activity and nutrition. As part of that, what we're doing with the LCAC dollars is the clinic is going to start a movement class. Rob Owens is one of the MAs there, and he has a degree in is it kinesiology? Is that the right word? And he's very excited about offering this movement class. So now the providers have somewhere that they can refer these kids to. So it's not just, go out and make sure you're walking and chasing your little brother around it. They have something actual science-based, research-based that they can refer people to. We are addressing 2 social determinants of health with our LCAC dollars. In North Lake, the clinic has an established program where they prescribe vouchers for adults who have any kind of diagnosis that's going to benefit from eating more fruits and vegetables. I think that they're funded specifically looking at diabetes, obesity, those kinds of diagnoses. And the vouchers are good for fruits and vegetables at one of the 2 or both of the fruit stands that are up there in the north end, as well as 3 grocery stores in La Pine. So with the LCAC dollars, we are playing off of that established program, and they will have fruit and vegetable vouchers for kids. We're less concerned about an obesity problem up north and more concerned about malnutrition. And so, again, these kids will have a diagnosis, something that's going to benefit from eating more fruits and vegetables, which is basically everything. And the goal, I don't remember what the goal is, but they're hoping they can serve quite a few kids with this program. Down here in South Lake County, we are going to work on encouraging families to be active together. We're going to buy playground equipment for Seroptimus Park, which you guys know there's been a lot of work happening at Seroptimus Park with the disc golf folks there. There's still the track, and there's still people who go out and walk on that track there. But the hope is that when older kids or adults are risking their necks on the existing equipment or playing around a disc golf or walking the track, that we have a jungle gym type structure there that the little kiddos can be active, so we'll have a place for the whole family. So that's LCAC. We have.
I don't want
No, go ahead.
to, I know there was a contingency on that.
Yes, we have to talk with the town and figure out liability and different things with that. That's-
Right.
Yeah.
Yeah, I was on that subcommittee and I was arguing heavily about, the improvements to that being part of the built environment for social determinants of health, and they went with it, but they were way more concerned about that than I was. I think you just give it to the city. If it's the city's park, then they assume the,
The liability.
yeah,
Yeah,
if they want to buy the equipment, but,
yeah.
Thank you, Paul.
well,
Yeah, thanks for pushing that through.
the other, they were questioning whether it was a capital expenditure or not. That's not allowed under the LCAC dollars, and I was,
Leonard. So the second grant we applied for was for the adolescent well-care visits. I renamed it, it's been the Outback Strong Teen Health Fair, but for this year, we're only gonna have one teen health fair, and all of our other efforts are different. So it's now the Healthy Gen Z project, just so everyone's on the same page here. So the learning fair that Arvinder mentioned happening next week, that's the first event happening under this grant. We'll do something similar during Lakeview's parent-teacher conferences, where our clinics and public health and whoever else are set up during parent-teacher conferences to schedule kiddos for adolescent well-care visits, talk about reproductive health, get immunization information out there about something else that's not really part of the EOCCO, but given where we live in Oregon, it's a good idea to get the word out. And so the thought is behind, we're gonna have 4 grand prize drawings in this grant period instead of just the 2. So the deal is within 30 days or within a month of learning fair, that's how long the kids have to complete their adolescent well-care visits. And then a month after that, we'll do the grand prize drawing for those kids. And so for Lakeview, same thing, a month after parent-teacher conferences, we do they have to get their visits completed, and then a month after that, we do the grand prize. So timing-wise, it'll all work out, and everything will be done before everyone's out of school. So that'll be good. In the fall, North Lake has an open house in September, so that will be our target for the fall event in North Lake, to have public health there again, offering immunization information, reproductive health information, have the clinic there to schedule adolescent well-care visits. We are going to do a better job coordinating with Advantage Dental so that they can be at the open house that night collecting consent forms, and then the next day or 2 is when they actually deliver their services in the school. And then we'll do the teen health fair as per usual in November in Lakeview, and bus the Paisley kids here for that again. The other piece of that grant is we have to do some targeted outreach to our very hard to reach 18 to 21-year-olds, and by very hard to reach, I mean we have like 12 18 to 21-year-olds who completed a well-care visit last year. It's a ridiculously low number. So we're using the last of the dollars from our 2018 grant. There's an ad out now on Instagram, possibly showing up on Facebook as well. I'm not quite sure how that's set up. I set it up, but I don't know how it works. So there's no point in advertising on radio, newspaper for that demographic. So we're trying to go where they're actually at. So if you're on Facebook or Instagram, you may see our ad has an adorable kitty on it. And
Is WhatsApp used a lot in Lake County?
no, I don't know. You're a youth. What do you know?
WhatsApp?
Yes.
I don't think so.
It's not. It's actually, the company actually, it's actually starting to die off, and they're getting into some
It's actually
lawsuits.
owned by Facebook.
Right?
It's a big thing in
Yes.
like other countries.
Yeah.
Right, it
It's
is,
big
but I
in
didn't know
other
people
countries.
were using that
Yeah.
here. Because Facebook is really kind of not designed for younger people.
Mm-hmm.
It's the old geezers.
Listen,
We used to be on it before all you guys.
MySpace, and then Facebook.
10 years ago in Florida, they dubbed it Mom Book, and everybody quit all the good stuff.
It's true. It's true.
Yeah. As part of the adolescent welfare grant as well, so there was a base amount that we could ask for based on the number of kids, 12 to 21, who need adolescent welfare visits. We asked for bonus dollars. In order to get the bonus dollars, that involves having the dental sealants as part of our events and having the addressing effective contraceptive use targeted. We also set goals if we increase our number of folks who are actually coming in and completing adolescent well-care visits, then we have the chance to win bonus dollars. So there's some extra incentive for our providers there that we haven't discussed yet what to do with it. But we can get an additional $12,500.
Is that like dialing for dollars?
So the third one is the colorectal cancer screening grant. We have $15,000 coming in from that. We'll do the same thing that we've done for the last 2 years, where our clinics are working with a third-party vendor who actually does most of the work for us, which is why this works so well. The vendor is the one who contacts our EOCCO members between the ages of 50 and 75 who are due for colorectal cancer screening, and gets them in, or lets them know about all the options. We have a cool pamphlet and some information that Nom helped create before she moved on to not your boss anymore. And then they send a fit kit. She's the clinic director. Yeah, sorry, it's an old new, but
It was an old man. She just, now I'm not there, so.
Sorry, fit kits, the vendor mails fit kits to the people so they can complete the test at home and not have to do the invasive colonoscopy unless the fit kit results are bad, and then they will have to come in to do it. But it's been successful. We did really well the first year. We will meet the measure this year, even if it's by the skin of their teeth. This year, the addition is that this is the first year Christmas Valley is going to get to be part of it. They use a different fit kit, but we got the okay from EOCCO to go ahead with it. So we'll be bringing all 3 Lakeview Lake County clinics will be part of it, which is great.
I have a question on that. One of the barriers that we found, and I'm wondering if Paul has experienced anyone else, is that those codes that we have to drop for that are not billable to Medicare. Medicare is for some reason not wanting to cooperate in that game. And so if they have EOCCO secondary, that could be a stumbling block for some people. So I'm just curious if you've heard of that being a problem anywhere else. I know we're fighting it with the ACO because they obviously want us doing colorectal cancer screenings, but Medicare physically will not allow the claim to push at this time. So we're working on that from another angle, but I'm wondering if other people that are EOCCO secondaries are experiencing issues with that.
Have not heard,
Because it doesn't have to go.
but that's a good one to bring up to Summer. You know
Okay.
Summer?
Yeah, I just wondered because those
The
that are secondary.
dual eligibles are a small number for us, but, you know,
Because you pull off that code to bill it out to Medicare, it'll have to be put back on and rebuild.
right.
Well, this year they were really good about just reporting it, but that probably won't always.
Yeah, I don't know if that'll always be the case.
Yeah, we just reported and all that.
Okay, so the last grant and this is another one with conditions attached. We applied for more funding for our emergency department utilization grant. That helps pay for Kristen's salary. So that program. That program involves using our EHRs, our electronic health records, to help track an identified cohort, in our case 2 cohorts of patients, so that we can help them better navigate the healthcare system so they stop ending up in the ER all the time. So our initial cohort is patients who had a previous mental health diagnosis who showed up in the ER for a non-mental health related complaint. And we all have thoughts about that measure, but that's probably neither here nor there. And we got a late start. Kristen came on board in August, I think, and so we were a little behind the 8 ball, and then we had some issues with getting set up with the actual program that we're supposed to be using. And so everything is coming together. We've done a 12-month look back, but through that program we were supposed to then measure at 6 months and at 12 months. So we were able to convince EOCCO that we needed a little more time to see if this is actually working. And we're adding a second cohort of frequent flyers, which is just everyone who constantly shows up in the ER, which is a larger group for Kristen to track. But the good news for that is that we're already tracking them anyway, because we have an established readmissions meeting where you guys are all sharing the information and making sure these patients are getting where they need to go. So those are all the EOCCO ones. And then I'll just plow through the other ones as quickly as I can. So
By the way, a lot of the emergency department utilization ones had the same contingency, which was, just check in with us monthly on how it's starting off. So it's not just you.
did anyone else have the same issues that we did with the company?
Pre-manage?
Pre-manage.
No,
sure they did.
You were required to use pre-managed.
Everybody had to use pre-managed, I think they all had hiccups.
I know, but, yeah,
I
that was my
don't
question.
know that I haven't heard that.
Okay. They were a problem. So for summer lunches, we will complete our site sponsorship just to make sure that we are good to go again for 2019. There are a couple of different grants that we've applied for the last couple of years. We will ask for dollars through those programs again to support. Oh, I forgot this, in the LCAT grant. We do have money in our LCAT grants to support, help support a couple of junior park leaders, because that is helping kids be more active and eat healthy, so it's stress and social determinant as well. This is the interactive part of the presentation. So our opioid planning grant, we're starting to get results. We sent out surveys to behavioral health providers, primary care providers, and law enforcement first responders in Lake Planoff and Modoc counties, and we're starting to get their responses trickling in. So, like I said, trickling in, but I have heard back from, in Lake County, from probation parole and from Oregon State Police. So, I'll let you guys guess. One of the questions we asked is what kind of drugs they were encountering most often. And I'm wondering if you all can guess what they're seeing.
If they're seeing us uptaking
Is it cut with anything else besides?
We didn't get into the specifics of, yeah.
That was fentanyl.
I had a long drive with an officer on, so I'm just kind of.
What just made my day.
Number one is that. Probation parole, they're seeing a little bit different, clientele than the state police. So for state police, heroin is number 2 right now. In Lake County, they aren't seeing it so much from us, from Lake County people. It's people driving through, they get stopped. On the probation parole side, it's prescription painkillers are their number 2. So the opioid grant is on the right track there. And the next round of funding, so this is a planning grant and it wraps up at the end of September. We are going to go after the next phase, which is the implementation dollars. So all of the data that we are collecting, we want to actually be able to do something with and help the prevention with treatment and recovery and with all of the different needs that we're seeing. So that application is due in May, which is why I asked about the other opportunity, because it's going to take a little bit of work to do the federal grant. And then also, so for the other piece of data collection, it's the community survey, which, has Keith got his yet?
Yeah.
Okay, so any day now, if you were randomly selected to be one of the 1,200 people.
It sounded like he was randomly selected.
It totally is randomly
When I
selected.
opened it, I'm like, you gotta make sure you return that. He's like, it's just a letter
Who
saying
spent
it's
the
coming.
$2?
I have
They
not.
haven't got that yet.
We haven't got that yet.
So the letter saying, hey, there's a survey coming, you've been randomly selected, that has gone out. The surveys should be arriving any day. There'll be a second round of surveys in case you forget to return your survey the first time and need that nudge. And then after that, there will be a postcard to remind you for a final time to return the survey. And this is asking for your personal experience with opioids and kind of your own knowledge of what they're all about, and also your perception of opioid use, of people who use opioids, all of that kind of thing. So that'll help us, especially when we look at these implementation dollars, to figure out kind of where the education gaps are and where and how to approach those. So, yeah.
It's really important, even if you don't get the survey, if you hear people talking about it, encourage them to fill it out. But even just say, hey, by the way, there's a survey that's going out there. If you get this, please fill it out. Be helpful for the community.
And it really is 100% anonymous, I promise.
Yes.
It really is.
That's why we're using the company, getting a company to process it.
And to demonstrate the anonymousness about it is, even if you send it in the first time, you'll still get a survey the second time, and you still get postcard, because they don't know that you sent it in.
Exactly. Oh, I'll say too, so you guys have your magnets and your stickers that we spent advertising dollars on. But if anybody, if you guys
Patient
need some.
education.
Well, it was called advertising in the grant, so, yeah.
Not much wrong about my district.
Yeah, exactly. But I have a box full of these, so if anybody needs magnets, stickers, whatever to pass out for your Outback Strong meetings and events, then, yeah.
Susan, how is the tapering going at the clinics and Baylor?
I think the tapering is going excellently. I've noticed far fewer angry opiate patients. They understand that this is the program. We are very transparent and we have a lot less. I mean, you're still gonna have an occasional angry person, but not like it used to be.
Okay.
The staff is not taking the beating that they used to take, and the patients are taking a hand in their care.
Good.
That was it.
Do you have anything?
I do. Very pleased to say that on April 1st, well, actually on April 2nd, which is the Tuesday, the Oregon Health Policy Board will be holding their meeting here in this room in the morning. So this is the policy board that reports to the Oregon Health Authority on multitude of very significant parts that help direct the Oregon Health Authority. They're the group that, for example, did all the work to recommend to the Oregon Health Authority what was going to happen to the CCO, the 2.0. So they're coming to Lake County. On Monday, April 1st, they're going to be touring. They'll be, we're hopeful that we can get, as part of the tour, an opportunity to go to school, I presume ADA, where you're going to have students. If that will be allowed, we'll try to get arrangements because one of the board members of the Oregon Health Policy Board is a member of Food Share.
Food court, yeah, he's
Or
the
food-
VP of programs for
Vice
food
President.
court.
So,
Yeah.
I'll let Susan know and let me know if you would.
What was that?
Keep Susan in the loop,
Okay.
keep her, also let me know too.
Yeah.
so this is really an exciting opportunity for Lake County to talk to a very important part of the Oregon Health Authority about the integration, the role, what the CCO is doing, all of that in Lake County. And for people that very seldom come outside of Portland, this is an enormous opportunity to see the size of our county. I tried to encourage them to spend the night in Bend because they're going to stop someplace and drive from Bend down. I think they're going to Medford and coming over, which is disappointing because then they don't really get to understand the distance between here and Northland.
Right.
However, still. So if you are interested, the public is invited to participate or to sit in on the Oregon Health Policy Board meeting on Tuesday. So this is a pretty big deal. So Brooke will be able to showcase what she's been doing. We're very excited about that. I don't know if they're bringing cameras.
I've been getting in trouble lately for not wearing my shirt, so I've been wearing it a lot more.
Your Outback Strong or your food
No, my
court?
food core shirt.
No.
I'm supposed to wear it every day. So.
Tuesday's probably a bad costume day.
I was gonna say, how many does she have?
They need to
That's all I
provide
have.
5 of them for you, then, so grades can.
Yeah.
Okay. Anyone else have anything for the group?
James, you want to let them know about the EOCCO board?
That I will be taking Commissioner Kessner's old seat on the Board of Eastern Oregon ECCCO group. Sorry, just caught me off guard there.
Sorry.
But,
Well, I just like that we have representation.
yeah.
I mean, Charlie
EOCCO
generally
is-
goes too, but
I've been in contact with them, we've been going back and forth, and I believe on the 26th, Arvinder, they have a meeting for a regional meeting.
Are you going to be able to go to that?
I'm going to try. I'm in the process of rearranging my schedule so I can make that trip possible. And then, of course, Charlie and I, we've been in touch over when their next board meeting's going to be. You're not sure yet, you don't have a date on that? Okay.
After the application.
After the
Which is
application.
April 22nd. So
Okay, so sometime after that?
Yeah.
All right, perfect. But yeah, I'm looking forward to that and seeing what I can do as far as representing Lake County's concerns and being there. Yeah, that's all I got.
I'd like to mention, I think you guys all have this too. With the older adult collaborative, one of the things we've been moving forward with is having a village program, and the Klamath Lake Council on Aging is taking the lead on that. They've hired a volunteer coordinator for the program now, and we'll be setting up a website, and of course, linked in that website, somehow we'll also have the Outback Strong Village, and this is the logo that we agreed upon this morning, Lake County Volunteers in Action, and it's really all about helping seniors age in place, whether it is, as far as volunteers, it's both community volunteers, but also I'm hoping those seniors that are participating, finding ways that they can use their skills and their backgrounds to help each other out. Sometimes it's simply changing the light bulb to, we talked about, the Commissioner mentioned this morning about with corrections, possibly helping out with some of the things around the outside of the house. Could be simply cleaning the eaves to some sort of yard activities. Anything that could hinder seniors from being able to stay in their homes, addressing those things. Also looking at ways in which businesses could possibly support by having their employees volunteer 1 hour a month and having the employer pay for that time. Different things like that. So that's moving forward. I think we're going to be kicking this off with the daily days. Is that what our plan is right now? So, and it's exciting that, again, down here, if we get this going in a very, very rural community, I know the other communities in which I serve, we can certainly get that going there as well. So, great. And we're doing it in Klamath County.
Thank God. They need all the help they get.
Well, this is a partnership with Klamath. It's part of the Klamath Lake Council on Aging.
Okay. All right, I think we'll go ahead and adjourn the meeting. Thank you all for your time.